Well, welcome to today's update on the novel coronavirus of 2019. It's Saturday the 8th of February, and I do actually have some uncomfortable information to give you today relating to pregnancy. But just before we do that, one of the things that's concerning me about the novel coronavirus is that it's novel. That means our immune system will not recognise it initially as a virus. It will take time. So the genetics of the novel coronavirus is slightly different to other coronaviruses. That means that the proteins that those genetics code for are going to be different. So the presentation of the virus, the outer envelope, the bilayer on the outer envelope is going to contain different proteins that we don't recognise. And this might be part of the reason why people are sometimes testing positive for the virus but haven't yet got sick, because we don't know quite what inflammatory immunological reaction we should be mounting against it. So that is a concern, that it is novel, it's a new virus. Now, throughout the years I have actually taught and studied about the history of infectious disease, and in my country in 1348 the bubonic death arrived, the Black Death, Yersinia pestis bacteria, killed maybe 40-50% of the population. Don't think I'm comparing novel coronavirus to this, I'm not. But the point is that it was a new bacteria they had no immunity to. Or when Europeans first went to South America, it's estimated that smallpox, about 300 million people in South America. No one knows for sure, but there is certainly a massive depopulation because it was something they were completely unfamiliar with. Syphilis did a lot of damage as well. Again, I'm not comparing this with that. It's just the point is, if there's organisms we haven't come across before, we're at greater risk. It's not in living memory, but back in 1918-19, there was a huge influenza pandemic. And if you ask your older relatives, if Granny's still alive, she's probably got an aunt or someone that died in that epidemic if you're in Europe, although it was all around the world. So there's a few reasons I'm slightly uncomfortable about it. Anyway, let's go on to today's news, and then we want to think about the effects of the effects the virus may have in pregnancy. Actually, just before we do that, I've just heard on the news that there was a chalet in France with 5 Brits staying in it, like a skiing chalet, and one of them flew to Singapore and back, apparently, and went to the chalet with these other 4 mates, presumably, and they've all tested positive for the virus now. So that's showing a sort of a localized cluster spreading. So it looks like that one individual has given the virus. It's unclear whether it's 4 or 5 other individuals who are now all positive. And the reason that's concerning is, of course, we all live in houses. So one person comes home to the family, then everyone could potentially be infected. And we understand a child is infected in this cluster in France as well, of these British people on holiday in France. Right, what's going on today? As we said, Saturday the 8th of February. Confirmed cases, as per Johns Hopkins, 34,939 confirmed cases from China and other places around the world, in fact. Confirmed deaths 725, 2,317 recovered, which is good. 28 countries affected. Now, we have been using this modelling from the Lancet, which is getting a bit dated now, so I might stop using it. But from this modelling of the actual numbers, because this has obviously got a big lag time, from this modelling it may be that there's many more people infected now. 6th of February, it could have been over 300,000. And if the death rate's 2%, we're speculating, we don't really know. I mean, one of the good things about the start of an epidemic, if you can say there is a good thing about the start of an epidemic, is very often a lot of people who have low-grade disease and aren't very ill don't report in and therefore don't get counted in the numbers. Now, the death rates do get counted in the numbers because it's fairly obvious when someone's died. It's not too difficult a diagnosis to make. So the deaths are likely to be, at least in these official figures, that the death figure's reasonable from what we know. But the actual cases could be double or treble that easily, even allowing for these official figures. So that means the actual number of people that are dying could well be below 2%, well below 2% potentially, which would be good because of underreporting that you get in the early stages of an epidemic. So really there's an awful lot of unknowns at the moment. And as we've said repeatedly on these series, there's a lot of unknowns about the novel coronavirus. But there has been other novel coronaviruses before. So there was the severe acute respiratory syndrome, the SARS, and the Middle Eastern respiratory syndrome, the MERS, which are also coronavirus. So there's the SARS coronavirus and the MERS coronavirus. Now, I've just read an article in a letter really, the Lancet from the 6th of February. Now, when we don't have empirical evidence for something, and when we don't have clinical trial data and proper epidemiological data, the next best thing is expert opinion. So this is kind of the level we're at now. So this is expert opinion level. Although the experts, of course, do quote significant literature. So first of all, the severe acute respiratory syndrome and pregnancy. This was the outbreak of SARS in 2002, 2003, 2004. Last case was in 2004, I think, apart from one very sporadic case. So this is based on 12 pregnant women in Hong Kong with severe acute respiratory syndrome, coronavirus, during the 2002-2003 outbreak. And Hong Kong was badly affected, of course, by this. We looked at the deaths in Hong Kong and the cases in this outbreak, which were quite significant. Now, there's only 12 women in this study, which isn't a lot. I mean, basically in studies, the more cases you've got, the better. The more cases you've got, the more likely you are to be able to draw out general principles from many cases. So we have to be careful about reasoning from relatively small numbers. But this is what we've got. This is what's in the literature. And this is actually based on papers published at the time in 2003. Now, of these 12 pregnant women in Hong Kong, 7 were first trimester, first 3 months. And the second, so 7 were in the first trimester, the first 3 months of the pregnancy, and 5 were in the second or third trimester of their pregnancy. So 7 women early pregnancy, 5 women later pregnancy. And the figures here are pretty uncomfortable, I must say, for SARS. Now, again, we don't know if this applies to coronavirus. No one knows this. So we're kind of looking at the next closest thing, which is the SARS virus. And 4 of the 7 women in the first trimester had a miscarriage. So 4 of these women had a miscarriage when they caught the severe acute respiratory syndrome. And that is, it's just terrible, isn't it? I mean, it's just, it's an appalling rate of miscarriage. These were previously healthy pregnancies as far as we know. In the second to third trimester, 40% of the 5 women had fetal growth restriction, so that the baby no longer grew properly in the uterus. 4 of the 5, this is the 5 that's in the second trimester. 80% of the 5 women had preterm births, 1 spontaneous, but 3 were induced because the mother's condition was poor. And 3 of the 12 women died during pregnancy, so much higher than the normal death rate from SARS. Now, I've never pretended to understand the relationship between pregnancy and immunity, but there are certainly changes in immunity during pregnancy that can predispose women to certain infections, and that seems to be the case. So really quite disturbing. 7 in the first trimester and 4 lost the babies. That's it's quite disturbing, really. Let's hope for coronavirus, the novel coronavirus, it's nothing like this. But this is data from the SARS epidemic. Now the MERS, the Middle East Respiratory Syndrome, which is harder to catch than novel coronavirus, but more serious if you do catch it. So this is based on a study of 11 women in the Middle East, mostly Saudi Arabia, United Arab Emirates area. 11 pregnant women were infected with the Middle Eastern Respiratory Syndrome coronavirus. And most of them had adverse outcomes to the pregnancy. 6 of the neonates born required admission to the intensive care unit. 3 of the babies died. 3 of the neonates died, born to these 11 mothers. And 3 mothers also died. 2 babies survived from 1 baby each. 2 babies survived from the 3 mothers. So there's one case of a mother and a baby that died. 3 mothers died of the 11. Now, having said that, for MERS, the death rate is about 35% anyway. So that's actually roughly, tragically, what we would expect. But nevertheless, it is concerning. It's the death rate we would expect from MERS, but still disturbing reading. 2 neonates were delivered prematurely for severe maternal respiratory failure, so the mums couldn't breathe properly. So the risk there that is the baby would become hypoxic in the uterus. And the expert writing into the Lancet considers that SARS and MERS, people with the coronavirus SARS, the coronavirus MERS, pregnant women are at increased risk of severe infection, so they were more likely to get, the disease was more likely to have a more severe presentation, which again is presumably due to these alterations in immunity during pregnancy. Because of course you don't want the mother to reject her fetus as foreign tissue. So there are immunological adjustments during pregnancy. So this paper from the Lancet, 6th of February, pointed out these problems, and then as a result this is what they recommended. Systematic screening of any suspected 2019 novel coronavirus infections during pregnancy. So high index of suspicion and screen if there's any suspicion that mothers may have the novel coronavirus during pregnancy. And then what the heck did they do about that? Well, what they said was, if it's confirmed, extended follow-up should be recommended for mothers and their fetuses. That was it. So no particular treatment advised. Now there's a couple more interesting papers come out that I'm going to try and get onto today if time permits. But I think we'll leave it for today.